This message, we are able to circulate this, we are able to make it a chain of awareness, and let not this chain break, let this chain continue. Thank you so much. The next important cancer, cervical cancer, which is equally a menace as CA breast. We cannot ignore cervical cancer also. Dr. Gursimran Madam, she will be talking, she can highlight important things about the cervical cancer. Thank you. Wish you a good health. All of you stay healthy, stay fit. Thank you.
Hi, good afternoon everyone. It's lovely to see everybody here and come all together from so many places to be here and create awareness about breast cancer. And I'm sure, as Dr. Sonia said, it has never been so easy to get a mammography done on these. And by getting so many women enrolled for mammography programs, it is better to detect as many as patients who can be their pre-cancers or the stage 1 cancers, so that we can prevent women from falling prey to such a big problem. And in stage 1, if you are able to detect a woman in a pre-cancerous or a stage 1 problem, then so many lives and so many families can be saved. Because as you know, all of the ladies, they are like the pillar of their family. When a lady, she gets ill, the family just gets her doses. So, I mean, for us as doctors, as gynecologists, as women health specialists, I think women health is the most ignored one. Mostly women are putting their lives for a second. Whenever there are things, they will always go for their children work, their homework, and their husband work, but whenever it comes to them, they will always ignore it. They'll say, okay, baad mein chalte hain, no problem. So yes, it is very important if a woman has got some symptoms of a lump and she is 35 above, she can still go for a mammography. After the age of 40, we do recommend one mammography at least once or twice a year. And especially important for women who have got a first degree blood relation having breast cancer should get tested for two genes which are very important, BRCA1 and BRCA2. These are two gene mutations. If you find them in blood, then it is much more important to get yourself early screening done, because then you're more likely to have breast cancer. Also, women who are having overweight, obese, taking a lot of lipids, or having hypertension, diabetes, other risk factors also should bring it down to curb their problem of breast cancer. And yes, most important, the symptoms. So when you're going for a bath, every month after your period, you have to look for your breast. You have to check the symmetry of the breast. You have to check for any lumps. You have to check for any nodularity. You have to check for any rash, any soreness, any kind of redness on your nipple. Has to be brought to notice of a woman health specialist. Woman health specialist could be a surgeon. She could be a gynecologist. She could be a surgeon. Anybody. But any kind of discharge from the nipple, whether it is bloody, it is white, whatever color, has to be brought to a notice. Now what happens if a lump is detected? A woman just gets scared and she says probably it is cancer only. Sometimes, most of the times, it is fibroadenoma. It could be just a benign lump, not cancerous. We just have to follow it up or just do a simple FNAC to know whether there are any cancer cells or not. So, a proper examination and evaluation, there is a detailed evaluation which has to be taken up before we say that this lump is malignant or not malignant. So coming to a very important cancer, which is cervical cancer. Everybody knows, I just wanted to bring it to your awareness. What is cervix? Uterus, mouth is called cervix. So every month, there are cells which is forming in the transformation zone. So there is a very important test which is called PAP test. I'm sure, I think if you started this mammography on wheels, you can start this PAP smear on wheels also. So it's very important because, I have worked for various cancer institutes in Gwalior, in Mumbai and Jaipur. In Jaipur, I used to work for a hospital which was 800 bedded. It's the biggest hospital in Jaipur, referral center, Dulabji. So they used to have a van where we used to go 100 kilometers, 200 kilometers away, and we used to do pap smears in the van. So what happens is they're all the village women, especially women who are so poor socioeconomic, they are not having awareness. So you must create awareness. You all of them have maids at home. You should always create awareness in them, to get a simple basic pap smear done for them. I get so many of my patients who bring their maids to me and they tell doctor it's kabi kar do. So that's a very sweet gesture which you can do for your woman who are helping you out in your daily activities. And pap smear is a very simple test, can be just done in a simple OPD procedure. We just have to look at the cervix, it's just simple as applying a lip brush. So just a little brush, we apply on the cervix and it's done. Hardly I take 5 to 10 seconds, not boasting about it. But many of the women who come to me at 40s, they tell me, Doctor, pain to nahi hoga, is it too painful? Doctor, it should not take me long. So I just comfort them, it will take me 5, 10 seconds, it is done. But it tells me in near future, within 5 years or 10 years, are you a candidate for having a cervical cancer or not? Secondly, this test has to be repeated. The liquid base has to be repeated every 3 years. And the simple conventional pap smear, generally I do not recommend that. That can be done yearly. But liquid pap smear has a big, greater sensitivity. It is more able to pick up any cancer cells early. And country like Canada, they're sending health reminders. Almost every country sends health reminders to their women. You please come for your pap smear, only then we will renew your health insurance. Not a country like us where the government is not bothered about our health. What happens is that they have been able to reduce their cervical cancer risk from 40% to just 13%. So they just sell a postcard. They'll come to you. You'll have to go and get a pap smear done to your near facility, and then only they will renew your health insurance. So that's a very good thing, because if there are certain smaller cells which are precancerous, we just have to remove the uterus and the lady is cured. I must say this is the only cervical cancer, is the only cancer where a woman can get cured. She does not have to take any chemo or any radio if she gets detected in a pre-cancerous stages. Just if you are able to find that there's a honey safe. And many of the women who have got vaginal discharge, in the local language, which people tell licoria hai, preventive health checkup. These are the 3 backbone tests they will always conduct on a woman. Another thing I wanted to put in the mind, many of you would have got elderly ladies at home. So women above 50 and 60, they generally have a problem. They have a lot of burps and acidity, they have bloating. So you must not just brush off them कि acidity होगा, ये दवाई ले लो इससे ठीक हो जाएगा. Must and get an ultrasound abdomen after the age of 50, because an ovarian cancer can present with non-specific symptoms such as weight gain, or the woman will tell मेरे को weight बढ़ रहा है, or I'm having bloating, or I'm having burps, or I'm having acidity. So ovarian cancer is a silent killer. The ovarian cancer generally does not will give you symptoms like bleeding, because the ovary does not bleed inside. So there will be no symptom like discharge. But these are the non-specific symptoms which a smart doctor will pick up that this woman can be having an underlying ovarian cancer. This is a silent killer. By the time they reach to us in the hospital, they're already in stage 3, where sometimes I have to give them chemo, 3-4 cycles, then do a downstaging, then perform a surgery. And in the surgery also, I'm not able to clear out everything because it's all spread up to the lungs, to the stomach. It's a locally advanced disease, and the quality of life also goes for down. So it's important that women after the age of 50 must get an ultrasound abdomen done. So it's just a quick test, a preliminary small preventive checkup, which will at least identify if there's anything going wrong in the abdomen. So thank you so much, and if you have any queries, we and Dr. Sonia are open to this thing. And any question you have in your mind, whether you feel it's a silly one only, you can ask and put up. Thank you so much.
If you have any questions, thank you so much for the awareness that we never had.
The lymph node, there is a lymph which is draining to the armpit area. Many of the times the woman comes with just a swelling in the armpit area. She doesn't have any lump in the breast. It could be a first telltale sign of a breast cancer, has to be looked up.
And I think Dr. Sonia can also tell you much more about it.
Exactly. See, sometimes we may not even get any lump in the breast, and what we get at first is the swelling in the axilla. So, examination of axilla is equally important as that of breast. And even underarm, axilla, the underarm. Even that is covered in the imaging also. When we are doing mammography, so the axillary part is also covered, or ultrasonography of breast, we are covering both the underarm area also. So yes.